When we talk about ethics, there are some terms you should be aware of. Utilitarianism, the ethical theory that promotes action based on the end result that produces the most good or happiness for the most people. Kantianism is the exact opposite of that, and that suggests that decisions and actions are bound by a sense of duty. Christian ethics, do unto others as you want others to do unto you. Natural law theories, do good, avoid evil. Human knowledge of the difference between good and evil directs decision making. And the ethical egoism. Decisions are based on what is best for the individual making the decision. Sometimes we have ethical dilemmas as nurses, and these are situations that require us to make a choice between two equally unfavorable alternatives. So what do we use to guide us? Well, here are some key terms that can help us make these decisions. So beneficence means that we want to always promote the good of others. We always want to promote the good of others. And autonomy means that we want to respect an individual's rights, a right to self-determination, if we're thinking about healthcare. We want to emphasize the status of persons as autonomous, whose rights to determine their destiny should always be respected. Justice is a principle based on a hypothetical social contract between free, equal, and rational people. And the concept of justice reflects a duty to treat all individuals equally and fairly. Fidelity means loyal and faithfulness to the client and one's duty. And veracity is the principle that refers to one's duty to always be truthful. Nonmaleficence means no malice, and that's abstaining from negative acts toward another. This includes acting carefully to avoid harm. So let's go through some examples. If someone says, I will not hold it against the client that they mistreated another nurse, which ethical principle matches that nurse's statement? I will not hold it against the client that they mistreated another nurse. That is no malice, non-maleficence. How about the nurse's statement? The two clients who broke the rules need to be treated equally. The two clients who broke the rules need to be treated equally. That's the ethical principle of justice. I will advocate for my client when he goes to court. And that's the ethical principle of beneficence. The nurse's statement, I will tell you the truth about the physician's qualifications. I will tell you the truth about the physician's qualifications. Matches which ethical principle? Veracity. I will be with you during the entire procedure. I will stay with you. That's fidelity. And the nurse says to the client, we can explore the kind of treatment you are wanting to find. We can explore the kind of treatment you are wanting to find, and that is fidelity. The Nurse Practice Act defines the legal parameters of professional and practical nursing, and I've included the link for your reference. So tort is a claim when damage is done. False imprisonment includes seclusion of a patient, and we use seclusion and restraint as a last resort in psychiatric nursing. And when you do that, you want to make sure that you have frequent objective documentation. You would never want to use seclusion for the convenience of staff or as punishment. That would be a definite no. Nonviolent communication. is a technique that psychiatric nurses often use to, or in lieu of, things like seclusion and restraint. I know when I worked at OSU, we came a really long way in reducing seclusion and restraint numbers. So definitely when you have better training and the staff has better training, you can see less seclusion. Assault is approaching a client in a threatening manner, for example, with a syringe, threatening to bathe someone, threatening a drug to sedate someone. Battery is if a nurse actually grabs the client and gives the injection, or if they force bathe them, or if they touch someone when they've been asked not to touch someone. Now, sometimes you do have to give a forced injection for the client's safety or the safety of others. That is not battery. If we are thinking about confidentiality and right to privacy, of course, we always think about HIPAA. And there's something called the doctrine of privileged communication. So there's an exception to HIPAA if we want to warn a client who is a target, or if we suspect child or elder abuse. Again, the types of hospitalizations are voluntary, where a person comes willingly, involuntarily, where they come unwillingly, or an emergency commitment. And this might be the mentally ill person who is in need of treatment or they're gravely disabled. So types of lawsuits that can occur are lawsuits for breach of confidentiality, defamation of character, libel is written and slander is verbal, invasion of privacy, assault, which is fear, and battery, which is contact, and false imprisonment, which means restraining outside of an emergency. So again, restraints and seclusion should never be used for punishment or for convenience of the staff. So if you're tired, had a long day, somebody keeps bothering you, we can't put them in restraints or seclusion. The Joint Commission has really specific standards for use of restraints and seclusion. So I'm not sure how many of you are familiar with the Joint Commission, but they are the accrediting body that was founded in 1951. And they evaluate healthcare organizations and make sure that they are providing safe and effective care that meets a certain level of standards. And I have provided a link there if you would like to look up more information about that. So they come and inspect the hospital, they inspect your records and make sure that you're doing everything appropriately. And if you're not, then we have nursing liability. And we could be found that we had malpractice or we were negligent. Malpractice is negligence or incompetence. And negligence means failure to exercise the standard of care that a reasonable person would have exercised in that situation. So the basic elements of a malpractice lawsuit include things like duty to a patient. You failed to do your duty. You had a breach of the duty. The client was injured. And that injury was caused by not operating and meeting the standard of care. So how do we avoid liability? Well, we need to make sure that we communicate effectively. And that communication needs to be evident in accurate and complete documentation in the medical record. We need to comply with standards of care, know the client, and practice within our level of competence and scope of practice.
And here are a list of the references.